Hi, my name's Ed Shanshala. I'm the CEO of Ammonoosuc Community Health Services. At ACHS, we provide primary preventive health care. We do so that each of us can stay healthy. Why each of us stay healthy is a very personal and unique story. The following is a personal and unique story of one of our friends, families, or neighbors and why they stay healthy.
I was diagnosed with synovial sarcoma, which is a rare soft tissue cancer, in the spring of 2015. And it was a very unexpected diagnosis. I went in with what they thought was a torn rotator cuff and came out with a very aggressive cancer. COVID was scary for us to start off with. My immune system is permanently compromised thanks to this cancer adventure. And especially before the vaccine, we were very concerned about what that might look like for me, especially given that COVID is an upper respiratory dilemma. So I try to eat well, sleep well, stay, hand washed and relatively clean. Now that our kids are a little older, it's a little easier because they're not bringing home everything. But it's definitely changed how we do business because I have a harder time staying healthy. In 2015, everything was face-to-face. And that meant we were traveling to New York City a lot. It was a big day if I could get someone on the phone, but that was in a time and place before telemedicine was really part of our healthcare dialogue. And it's actually the difficulties with telemedicine were why I discontinued mental health therapy. I could no longer make the trip back and forth. Unfortunately, part of this cancer adventure means I suffer from chronic fatigue. And I couldn't make the 3-hour round trip. And that made it so I couldn't access care. So I did the best that I could with what I had, and that was that. So the biggest change since COVID is that telemedicine is increasingly accessible and allows us to do as much as possible remotely. There are going to be times when you absolutely still have to go. I have to get my monitoring scans in the big fancy machine at Dartmouth Hitchcock, and there is not one in the North Country that has the resolution high enough to do what I do. It's a given that I will have to go for inpatient treatment there. However, I don't necessarily have to wait hours and hours for the oncologist to then hear from the radiologist and then meet with me. And sometimes that was an 8-hour day. And I don't have to do that anymore.